The question is asked, differentiate between somatization disorders, conversion disorder, hypochondriasis, psychosomatic disorder. And then they ask, give an example of each in the patient's language, verbatim, to highlight the difference between the conditions. Let's describe somatization disorder. Somatization disorder, multiple symptoms. Usually one symptom at a time, but the symptom quality will change from time to time. The nature of the symptom will change from time to time, and it is over a period of 2 years. Usually multiple presentations to the hospital or doctors, and the presentation or the symptomatology will be different each time. Sometimes the patient may present with a headache, cause is unexplainable. Sometimes it could be tummy ache. Sometimes it could be a muscle ache. Sometimes it could be backache. Sometimes it could be nausea, vomiting. And sometimes it could be anything else in the body. For example, frequency of micturition. So that is somatization disorder. Repeated presentations and each time with a different symptom. Now we next go to psychosomatic disorder. Psychosomatic disorder, the presentation is same each time. It is one symptom which is causing distress to the patient. So the patient is presenting each time with headache or with aphonia or with muscle pain or chest pain, etc. But each time it is the same complaint. So that is psychosomatic disorder. In both these disorders, somatization and psychosomatic disorder, the emphasis is on the symptom. The patient knows that the symptom is distressing. They don't know about the diagnosis. They have no clue of the diagnosis. They want you to investigate and find the cause for these symptoms, but they have no guess about this. Now verbatim about somatization disorder is, doctor, I have terrible pain in my tummy, in the lower right part of my tummy. When I push, this pain gets worse. This pain revolves all over the abdomen and sometimes all over the body. 3 months later, the same patient comes and says, I have terrible nausea and vomiting. The vomiting is not stopping. Now that tummy pain is gone. And the patient's verbatim will be, I want you to do all the tests to find out the cause of this pain. So that is about somatization disorder. Psychosomatic disorder will be, patient is presenting again and again with the same symptom, saying, doctor, my voice is gone. I don't know why. I want my voice back. So the patient, there is no voice, and they are writing to you, but they are really distressed. Or other examples, a more appropriate example will be headache. Doctor, I have terrible headache. I want you to find the cause for this headache. The headache is killing me. So each time they are presenting with headache and no other thing. I would use the example of aphonia under dissociative disorders, not here. So somatization disorder, psychosomatic disorder, same symptom. So if it is tummy ache, the patient will each time come and say, my tummy is hurting. I can't bear this anymore. Now let's move to the dissociative disorder. So the patient has one symptom at a time. The symptom may or may not vary. The patient is not distressed about the symptom. People around the patient are more distressed about the symptom. The symptom has usually a neurological quality, or so neurological flavor to the patient. For example, as I said, the voice is lost. The patient is not distressed. So the patient will write, I can't speak. But they are not distressed. They will only write if you ask them to write. And otherwise they are almost happy for the symptom. They can't move their legs. They will say, I can't move I can't move my leg. But they are not distressed. The family is more distressed. So that is conversion. So far, we are with the symptom. And I've given you verbatim for all three: somatization, psychosomatic, conversion. Somatization disorder, repeated presentation, different symptoms, patient is distressed. Psychosomatic disorder or single symptom somatic disorder, same symptom again and again, patient is distressed. Patient wants you to investigate but doesn't have a clue. Conversion disorder, again, it is the symptom. The patient is not distressed about the symptom. The family are more distressed about the symptom and wants it to be investigated. Now the fourth thing, hypochondriasis. Hypochondriasis is that there is a symptom, but the patient's focus is not towards the symptom. The patient's focus is towards the diagnosis. Doctor, I'm having a headache, or I had a headache. I'm very sure, or I'm almost sure, or I'm afraid, I'm fearful that there might be a tumor in my brain. Doctor, I'm having palpitations. Maybe I may have a valvular abnormality in my heart, or I may have an aneurysm somewhere. So there is a symptom, but the symptom is misinterpreted, and due to the arbitrary inference, you reach an illogical conclusion, and you want to prove or disprove that conclusion. Usually they want to prove that this is the case and this is the diagnosis, and they want people to come to the diagnosis. So that is about the hypochondriasis. hypochondriasis. The focus is possible diagnosis and fear for that diagnosis, and not the symptom itself. An example I have given: Doctor, I have severe headache. I am fearful, or I know that I might have a tumor in my brain. So, this is all about all these disorders. Thank you.